Hi, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor. I'm going to adjust Erin, who is actually at this point just getting adjusted right before her exercises. This is what she would be doing with regards to brain-based neurology and posture. The purpose of the adjustment, more than anything for her, is to kind of stimulate and activate the nervous system for what is about to come. It's, look at it like a teacher walks into a classroom and says, hey kids, listen up. What do? You sit up straight and you're ready to hear something important. So that's the stimulation. That was the trigger that told the students to pay attention. So in Erin's case, we're just going to go ahead and adjust her based on what I find to be restricted when I do a quick little scan of her spine. So Erin, go ahead and lay down on your tummy.
Sounds good.
So here, I'm just looking to palpate her spine. And right here, we're going to adjust. So Maddie, are you close enough? Take a nice deep breath in there, all the way out. Relax your shoulders. Very nice. Now bear in mind that there are many different techniques to get adjusted, just like there's more than one way to get to this office. So it's not the adjustment technique that matters, it's what it does that is the focus here. Go ahead and lay down with this side up. And move up a tiny bit, sorry.
Sure.
And tuck your head forward. Beautiful. Erin's a pro. Nice and relax it. Face the other one. Back. Now in some cases, some people are actually, it's not a good idea to get adjusted this way. And so in those instances, I adjust the patient with a different technique. Sometimes people are afraid of getting adjusted this way. Come up towards me. And that should be actually respected. Erin, go ahead and bend your knees for me. The reason we bend the knees in this case is to take some of the tension of the muscles pulling down the other direction, so I can get a nice reading of what that one's sore a little bit maybe.
Yeah, it totally is. Also, this knee up here is sore.
We're gonna take a look at your ankles too. All right, well that one already went as I went, so the bottom line here is to never force an adjustment. Adjustment is a dance. And not a break dance, it's a waltz, right?
Hopefully not a break dance.
So nice and relaxed, beautiful. So we'll repalpate. And like I said, this is in Erin's case is to stimulate the nervous system and really to put things, to put the spine back in the place it needs to be. Very nice, Erin.
I try.
Go ahead and move up a little bit. We're going to adjust the ankles, or at least check the ankles for any possible adjustment needs. Hold on to the table.
Got it.
All right, so Erin mentioned that her knee is hurting. So I'm going to take a look at that and kind of examine that. Is that sore, Erin?
A little bit.
It's actually, I can feel that. So go ahead and extend your leg up that way. Bring it down. Go down all the way and bring it up again. No, bring it all the way up and then go down again. So this is 1, that is 2. Stay at 2 until I ask you to go down to 1. Go down to 1 and 2. Is that sore?
Ooh, yes, it is.
Go all the way up. So you see how she doesn't go all the way up? That's because her brain knows that's going to hurt. So I need to do further examination here, but I can tell you in this case, the outside of her front of the leg is doing a lot of work. It's pulling out. So it's going to be definitely an area to look at, is to be on the right side, glute and lower back. Erin, which was your dominant eye?
My dominant eye was my right eye.
So your right eye is the dominant. This is a great example. So you see how this is her right side, which means the left side of the brain controls that side. Movement and sensation here. So if Erin's non-dominant eye, weaker eye, with regards to balance, is on the left side, the right side is going to be compromised. In this individual, I actually suspect to have more problems on the right side than the left side. Not because, are you right-handed?
I'm actually ambidextrous.
That's interesting. A lot of times people think, well, yeah, I'm right-handed, so that's my dominant side, which by the way has nothing to do with eye dominance. And so they think that their injuries happen on the right side because they use it more. And I'm telling you that is not necessarily the case. So in Erin's case, I need to examine this. This is something new that's happened on this visit, so I need to look into it more. But as far as what a treatment would be like, this is the chiropractic portion of the treatment, which is followed by doing activation exercises of the brain and the body parts in the brain gym outside. Thanks for watching. If you have any questions, don't hesitate to contact me, and talk to you later.